Okay, good afternoon, everyone, and thank you so much for attending our Master of Science and Global Health alumni panel. Right now, just so everyone knows, we're recording this session so that both our attendees now can watch it again and future attendees can also ask questions or know what questions were asked. My name is Madhavi Dandu. I'm program director for the master's program, and I've had the opportunity to be involved in the program for the last 12 years or so. And today our goal is really to introduce you to some of our alums and allow you several opportunities to ask questions. So before I introduce our alums, just a note to our participants, feel free to use the Q&A button at any time to ask a question. I will keep monitoring that in case you have questions, and feel free to just do that at any time. You don't have to wait till the end of my series of questions. So thank you very much, first of all, to our panelists. I'm going to go ahead and ask us to advance to the next screen. We have three special alums here today who were very kindly agreed to talk to us about their experiences. So I'm going to go ahead and ask each of them to introduce themselves, a little bit about their time in the program, to talk a little bit about their time in the program as well as what they're doing now. So I'm going to go ahead and actually start with Akasha because you're the first on my screen.
Hi, everyone. Welcome. My name is Akasha Paulo. I graduated 2018, a long time ago. I went straight from undergrad to the master's program at UCSF. I currently am a research program integrator for GE Healthcare. So I do research on pre-market ultrasound devices before they're commercially available in a clinical setting. So obviously I'm using my master's. I also just recently got accepted into the University of Wisconsin's Madison's medical school program. So I will be a medical school student starting in August of 2022. How long did it take me? I had a couple of jobs before I secured this official job, all in research. I was a clinical research coordinator at a medical college for Wisconsin as well. So yeah, probably like a year out, I got like my first big girl job.
Thank you so much, and congratulations. We're so excited.
Thanks. Thank you, Madhavi. You were very helpful.
Sochil, do you want to introduce yourself?
Thank you. Hello, everyone. Nice to meet you. My name is Sochil. I graduated in I wrote it down here because I forgot, 2017. Before the master's program, I was a bit of I don't know if it's a non-traditional student, but definitely had a few years between my master's and my undergrad. So in between my master's and my undergrad, I was exploring a career in possibly medicine. So I was doing some pre-med stuff, but as I was doing my pre-med stuff, I was also, the jobs that I had were really involved in like business and social impact and sort of different kinds of startups related to like health equity and just like social justice. And so I was thinking like, what do I want to do in the future? What is the kinds of things that excite me? And so I was thinking, I'm not sure if medicine is the best fit. However, I still like to explore health, and I do a lot of stuff in global settings and sort of innovative thinking, and I thought this master's program would be a good fit. So I joined the master's program in 2017, and then since then, I had a couple of jobs in between. Afterwards, I was a research assistant for a little bit, and then I got hired as an executive director for a small health nonprofit. And then from there, all COVID happens, and now I'm basically helping run the COVID program here at Santa Clara County.
Thank you, Sochil. And Linnea?
Hello. Hi, everyone. Thanks for coming in today. So similar to everyone, I'm kind of all over the place in my story as well. So I graduated in undergrad at UCSD about 2015 or 16. And then since I started at the master's around 2018, 2019. Oh God, the years are all blending in, that pandemic brain. But between my undergrad to the master's program, I was a kind of like a front desk clinical assistant at an ophthalmologist office. So I was helping like run the clinic, get people ready for surgeries and stuff. And I realized I didn't really want to stay in that position. I wanted to do more. And I already had a global health background in my undergrad because I had a dual major in it. And then I was looking for different programs. I was also thinking about medicine, but I also liked the direction of having, like a pit stop, maybe like at a master's program to kind of figure out what I wanted to do. And then 2018, 2019 was my master's program. And then, as you all know, the pandemic hit and I was like, oh gosh. So in that time, I was able to publish my capstone thesis into a journal. And, I kind of was just like, oh God, what is life? But since then, because of COVID, actually, I found a job at UCSF where I was kind of researching transmission within the city and county of San Francisco, like transmission occurrences. But that study is over now, and I'm still at UCSF. I'm a project policy analyst working on VR in health equity, so using virtual reality to train up physicians to have more empathy and to really show forth their cultural humility when working with BIPOC patients or people of color, racially discordant patients than they are. And I'm still working on that. I think the project is ending, so I'm looking at other projects to join, but maybe down the line, I am also interested in medicine and research at the same time. So we'll see how that goes.
Thank you, Linnea. I was so excited. I'm on that project team when I got the email saying that you were supporting that project. So they independently saw that you're awesome and hired you. So that was exciting. So I'm going to start with a few questions again for the folks that joined us a little later. Feel free at any point to put your questions in the Q&A. But I'm going to just start by asking, why did you choose this program in particular when you were looking at different master's programs and different opportunities? And anyone can start.
I can go first. Like I said, I graduated undergrad 2017. I was really young. When I graduated my undergrad, I think I was 21 still. So I was kind of in this limbo of, yes, I did want to do something in healthcare. I wasn't dead set on medical school right away because I was like, that's a lot of money, that's a lot of time. So I was playing with the idea of other healthcare professions like a PA or an NP or something. So I decided that maybe a master's in would give me some more time, like Linnea said, like a pit stop would really maybe direct my attention and make me focus on what is important for me and what I'm looking for in my future. I think I chose global health specifically because I had some personal experiences. I'm originally from Puerto Rico, born and raised, and I went through some just hardships with my family. And I really was interested in this field and how I can impact it, what I can do to help others in my situation or worse than mine. So I think that was really the deciding factor that I chose to do this specific master's program.
Thanks, Akasha. Social, do you want to go next?
Sure. Why did I choose this program? Well, honestly, I think I've heard of this program when I was way back in undergrad before I even applied. And as I was, progressing through going to the post-bac program, thinking about going to medical school, this program just kept on coming to mind because of the social entrepreneurship things I was involved in, and the fact that I've always been interested and had done a lot of work in global settings before. And it just seemed from other past students that this was a really amazing experience for them. And, at the end of my exploration of, my post-bac program, everything was good. I was ready to go, but I just was still felt with this feeling of is this really do I really want to go to medical school? Is that siloing myself to something that's extremely specific when I have all these other interests that I want to explore? And this program really just seemed like the right amount of time, a year, given the fact that I was an older student. So I was like, okay, a year makes sense. It was local. I am from Santa Clara County and I was living in San Francisco at the time. So it made sense for me. I just really believe that the program offered a comprehensive curriculum to be able to really learn the basics of things like public health, right? But from a global health perspective, but also, and this was really important for me, apply my current knowledge and my current skill set to a capstone project. So it wasn't just going to be me in class learning, but it was going to be me in class learning things that I hadn't quite gotten to depth before, and apply those things in a setting. And the fact that I've been working for such a long time and wanted to use this to leverage my career, whichever way I go, medical school or not, the capstone was definitely a draw for me.
Thank you. And what we can talk a little bit more about the capstone a bit later on, because I think it is one of the number one reasons people look at the program, and one of the favorite things people have as they're graduating from the program. So thank you for sharing a little bit more about the capstone. Linnea, do you want to share a little why you chose our program in particular?
Yeah, just to touch on like why global health, as a broad overview, going into undergrad, I really came in looking at biology only, but I like the idea of global health, really looking at for those of you choosing between global health and public health, I really liked that it incorporated politics, history, and like interactions with different countries and things. It wasn't just about people's, cells and how their biology works in improving their health. It's really about the spaces around them and what factors have influenced their life. But focusing in on just the master's program, I really like this program. One, because it was at my dream school. I actually grew up in San Francisco for a little bit, and I've always been I've gone to dentists and doctors at UCSF. So I don't know, UCSF was pretty high up there for me. But from a personal level, being at UCSD for like 7 years, that's in SoCal, and my family and everything is here. I really wanted to come back to this space and to just be near my family again. And the program was really helpful. It touched on topics that I was familiar with and other areas that I wasn't familiar with, like comparing different health systems, how politics plays into the healthcare and the health of people in different places. So it brought on those new perspectives.
Thank you so much. I think that instead of going to my next question, I'm going to jump into the question asked by one of our attendees, because it fits exactly what all of you are starting to talk about with it, which is the capstone. So how did you all go about choosing your capstone projects or mentor? And what advice would you share regarding the capstone research project overall?
I can jump right in if that's okay. I would say, so you choose your capstone mentor within like the first quarter, I guess. So like around October, November, December, but definitely go to different mentors that are in your area of interest. So I came in without this like really big plan, which wasn't great, I think. But I knew I just wanted to publish and try out qual or some sort of quant. So try to understand what methodology you want to learn more about, such as qualitative work, which is, talking with people, or quantitative work, which is more with numbers and stuff. Figure out the methodology and then see what mentor fits that methodology. For me, I was interested in, I gotta do field work, I gotta travel, because I'm used to that in undergrad. I used to do, volunteering abroad and stuff. So I had that mindset that that's what I should do. But don't focus in on, it's all about the traveling part, like that's cool. But definitely try to rein in on what methodology you want. If the methodology happens to be a traveling sort of project, all the better. Like if you're going to do qual work and you're going to be talking to people on the ground somewhere abroad, super cool. But definitely figure out your methodology.
Thank you, Linnea. Before I ask Akasha and Sochil to answer, I just wanted to say that we do help guide people a lot in asking these questions, but and also want to emphasize, being in the field, we think about really broadly, both domestically and internationally. So our students do projects across the spectrum. So sorry, don't want to jump on other people's thoughts here, but I just wanted to add that just as a learning. Go ahead.
I can go. Yeah, so that was actually perfect, because I was going to say that my capstone was domestic. I didn't go anywhere. I stayed in San Francisco. But I still think I learned a tremendous amount from my capstone, even just being here. I did it in pediatrics, so like cleft palate and cleft lip infants around the world globally. And that was interesting. I spoke to like nonprofits that go to countries and do these surgeries, and I really essentially did like a needs assessment asking like, you know, there's this device that might be on the market. Is it useful? How would we use it? How would we allocate it, et cetera? I think going about choosing my project, I think the faculty was extremely helpful with, like Madhavi said, like really giving you that direction, really asking a lot of questions on what are you interested, what do you want to do? I think I started with pretty vague, just like, I think topics. I was like, I know I want to do peds or refugees or like HIV. And then I kind of took it from there. I remember you guys bringing a couple of like PIs to my attention. And then, yeah, I just met with them and kind of like Linnea said, just really ask them, what are you looking to do? How can I help? And just see if that aligned with what I wanted and what I was interested in.
So the question was, how did we go about choosing our capstone, Madhavi? Was there anything?
Yeah, it was, how do you choose your capstone and your mentor, and any advice for people who are, as they're looking into this, on how they should go about the process?
Okay. So I think similar to the other panelists, thinking about, for me, when I first got in, I had a very like specific intention, you know, like before I was thinking about going into medicine, that now, you know, like I've always wanted to be in a leadership position in whatever thing I was doing. And so I was thinking, you know, one thing that I really want to have a formal training in is some sort of like systems thinking, you know, systems thinking on a global scale. I had done a lot of nonprofits before, working with different countries, strengthening systems, but I've never had any formal training. So for me, I was just like, okay, the topic that I want to explore is systems thinking and how to look at a system, how to break it down, and evaluate it. So having that in mind, I think the program did a really good job in matching me with my mentor. Some advice that I would have is, you know, there will be certain points where you have to present, you know, like what you're doing for your capstone before you actually go off, and then after you come back, like what you actually did for your capstone. So there's different things, milestones that you have to meet within the program. And, you know, initially so like location wasn't necessarily a draw for me, it was more like content. And so the initial project that I had been chosen to do was in London, working with the university there on, I think like contraceptive devices, online contraceptive devices through the NIH. In conversations with our partner, you know, I realized that perhaps they weren't quite ready to host a student. And so I worked with my mentor and just sort of expressed to her, you know, like what my goals were, what my concerns were. You know, I really like the program, I really like the project, I'm really excited about it. However, it doesn't seem like you know, we're quite prepared to build on this partnership, given the communications. And so I think that was really important. I think it was really important because I could have gone, I think it would have been fine. I would have learned something. I would have gone to London, you know, it would have been great. However, given my specific goals, like I really wanted to learn, I really wanted to evaluate, I really wanted to practice and exercise. It didn't seem like a good fit given, you know, where the program was at. And so my mentor did a really excellent job in sort of advocating for me. And then, you know, one thing that I would also advise you guys on, which will bring me to my next, like my actual capstone, is it's really important that if you have a topic in mind or something that you're really interested in mind, that you really network with the professors that you know have that interest. You know, like the professors come and teach classes, but they don't necessarily stay and chat with you, right? Like any other school, everyone's busy. But really taking the time of selecting those professors who you know have that content knowledge or that career path that you want to tend towards. And so, you know, I had learned that earlier in my career. So luckily I had networked with a professor who did systems thinking, and you know, it was 4 weeks before my capstone. I had no capstone. I had already presented on the London capstone. I was like, what's going on? But, you know, in the end, because of, you know, my mentor advocating for me and understanding that, you know, I was looking for something different, and the ability to network and having identified and created a good relationship with one of the professors who had systems thinking and understood what I was looking for, I was able to connect with the project that really was nothing like what I had expected, but everything that I would have not thought to ask for. So I would just say, 1, advocate for yourself. 2, I would really, guys, I would really take the time to think about, why am I going to this program and what is it that I want to get out of here? It is really important. And I say this to everyone who thinks about applying to any master's, but especially this one since it's so short. Why? why before you come in, so that when you're in, you know what, right? And that'll really maximize what you'll get out of the program.
Thank you so much for that. I just want to share that you all hit on some really, really important characteristics when thinking about a capstone project and also the program in general. One is that, you know, the work in global health is very, it's so much about the skills you want to learn, but also the relationships you have. And the relationships both in terms of mentors and colleagues and peers and your cohort and the population or people with whom you're going to be working or working alongside. And so when choosing a capstone project, even though we prioritize skill building, because that's what it is, it's a learning experience, you know, there's so many adjacent skills, communication, relationships, flexibility, resilience when your project falls through, as Rachel just talked about. You know, what are all the different secondary things that we're learning? And it's secondary not because they're less important, but because they're maybe more subtle, that are really important for what kind of work you'll do in global health later. Those are the kind of things we like to explore. And so even though there are just endless opportunities, most of our students struggle actually with narrowing it down rather than having a difficulty finding something that they're passionate about. So that's a lot of the work what we'll do with folks, is to really do that reflection before you even come in, like Sochil is suggesting, and also thinking a little bit more about staying open also to all the things that you might not even know exist. So we have several more questions. I'm going to move on. Jasmine asks, what is your advice for financing your education or tuition for the MS program in global health? And I'll add some more after as well, but feel free to share if you're open to that.
I can go. I think obviously you can apply for a financial aid. I know that I did that. I know that I'm local, so that really also did help with the costs. One of the things that I also did at the beginning of the program, which I would advise against, is I thought that I could work while doing the program. So previous to starting the program, I was a clinical research coordinator at UCSF in the OBGYN department. I was like, oh, it's literally right next door, literally, like right next door. Like my department was like 2 floors above, right? So I was like, I could do it. I could do it part-time, you know, it's super easy, it'll be fine. And I had done this before during undergrad, but I would say the program is so intense. It's so many hours. And there's a level of detail that this program requires out of their students that is not something I've experienced before. And so there was a huge learning curve for me, especially in the first semester, or the first quarter, excuse me, right? Because like I was going from work mode into school mode. I had done both before, but this was at an intensity that I hadn't quite experienced before. So, you know, I would say, you know, if you're thinking, oh, I'll work while I'm doing this, that might work for you. But for me personally, like I found it, once I sort of stopped working, the program more enriching and my ability to engage better. This sort of tangentially answered the question that was asked, but I would say, you know, financial aid. But if you're thinking about working, to really seriously consider how you might balance that. If you do consider working, though, just to plug, I did end up going, you know, Madhavi and the team sort of helped me sort of think about how I could better like manage my schedule as I was working. And so they connected me with some like academic advisors that the medical students actually use. And so like a lot of the things that the academic advisor told me was extremely helpful, but either way, I think it was useful not to work because it was just a lot. But that's my 2 cents.
Thank you. I'll let Akasha and Linnea add in just 1 second. And we do, I want to be as honest as possible. We do recognize that it's so hard to ask most people to do a very expensive program and live in an expensive city and not work. But I do want to reemphasize or just say again what Sochil is saying, because it, especially in the beginning, and I would say the first 2 quarters in particular, it is really, 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 really busy. And not only is it busy, it is, it takes, and this kind of goes to a little bit to the next question, which I'll ask after. It really takes not just your time and energy, but our students are so deeply committed to these topics. Like, you're basically exploring things that are not just about your profession, but in a lot of ways how we exist in the world. I don't want to over dramatize that, but I think it takes a lot of space, mental space, and our students really do struggle if they are working more than a few hours a week. So I just wanted to share that as well. But Akasha and Linnea, sorry I interrupted you both.
No, that's okay. I'll go first. I love that you brought up that point, Socho, because I did work as well. I didn't work at UCSF. I was a server at a Mexican restaurant in the Mission area, but either way, I worked Saturdays and Sundays only, or I tried to limit my days to Saturdays and Sundays. That was pretty exhausting. I mean, like, since I had to make essentially like a week's salary in 2 days, I probably worked, triples, right? Breakfast, lunch, and dinner. I did it throughout the whole year. It did get really challenging towards the end when you were kind of wrapping everything up and deciding like, okay, what's my next move? Again, like, I'm not from San Francisco, so I graduated my undergrad from Florida, so I traveled all the way there to live there. So I was kind of, doing all that stuff as well. So I would say financial aid is the way to go. But I'm not going to say it's impossible, because obviously I did it. But yes, I think Madhavi hit it right on the head. You just learn so much, and it takes a lot of time. There's a learning curve to this, especially on the quarter system. You're in class for so long that by the time you get home, or like if you have to work, it's very challenging to like not think about the program and things that you have to do. So even after work, like working 9 to 10 p.m., I would go home and like go to campus and study and like pull all-nighters. And I think that's where like my cohort came in to be very, very supportive and helpful, but it was challenging to do. So just take advantage to the financial aid package would be my recommendation, and Grad Plus loans, whatever they can offer you.
Yeah, just to touch on that, everyone's saying, I totally agree with the financial aid packages. Take out those loans, because in undergrad, I tried to do the same thing. I tried to work 2 jobs and, run my 3-4 classes. It was horrendous and I was a hot mess. And I knew that I wanted to prove to myself that I could be a good student. So take up Social's advice. There are so many great resources. There's a learning counselor, like How to Learn, that the med students use. And I went up to her and she said, don't work. And I was like, I'll follow you, because I know I won't be able to handle it emotionally. And like Madhavi said, the first quarter is rough. You're taking, I think, like 6 classes. And I remember my cohort and I would, we had Mission Hall. We had access like all the time, and we would have like 12 a.m., 1 a.m. study sessions when there was a midterm coming up or a test. George Rutherford, one of the professors there, has a weekly like geography quiz, and yeah, the sessions with my cohort was great. But yeah, definitely take advantage of that financial aid. Like, yes, it's loans that you can pay back later, and then they'll help you through like how to pay that all that back. So yeah.
And just to highlight one other thing, all 3 of you have mentioned, or especially Linnea and Social mentioned getting support. So the person that you might be talking about is Peggy Ryan, who's a superstar learning specialist. And actually, because of the experience of all of you over the years, we've actually incorporated her more directly into the program. She comes and does sessions, is involved in our orientation, and I learn a lot myself about just how to structure and manage my day. And that leads very well into the next question from one of our attendees, who asked, the classes and content of the curriculum seem very interesting. I was wondering what an average day as an MS student at GHS looks like. And before I let you all answer, you were asking a little bit, the questioner asked a little bit about class start time and flexibility with choosing classes. So I'll just answer that, because that might have changed a little from when you were there, or hasn't changed fully, but and then you can add a little bit more about what your day looked like outside of what I'm describing. So the program itself has no course choice flexibility, generally speaking, meaning all of our students take all the same courses except for one elective opportunity in the winter quarter. So we are, I had always trained in a semester system, so a quarter was different to me, but we're basically a 4-quarter program. The fall quarter runs kind of September to December, then next quarter, January to March. Then we have a shortened quarter that's kind of April to June. And then we have a start in the summer quarter, which is just a one month portion of the program. And basically, you're taking 6 classes, then 5, then 3, and then 1. But so you're in class a lot. So in the first quarter, it's basically Monday through Thursday, essentially 9 to 4, Monday, Tuesday, Wednesday, with a half day on Thursdays. And then it goes down a little bit after that. It's Tuesday, Wednesday, Thursday in the winter quarter, and then 3 days in the spring quarter. And what's really important in terms, a lot of that is class time. So we've adjusted it a little bit with the pandemic so that class time is more, each class is more like 2.5 hours in class rather than 3 hours. But the time in class is not just didactic. It includes lots of discussion, activities, breakout sessions, small group work, presentations, etc. And of course, on top of that, there's preparation required for every class. So there's pre-work that also needs to be done. And then just in terms of the electives, those change every year or can change, but we've always had classes like women's health and empowerment, strategic information, cost effectiveness analysis, and several other classes like that become an opportunity for one elective in your winter quarter. So just a little bit more, maybe you could share one or two, or maybe all of you, about what your day-to-day look like beyond just the class time.
Sure, I can go. So after class, this is just my personal self-care thing. I'm a video game girl, so I had to just get out of that mindset. Just like Madhavi said, it is emotionally draining because there are some topics, especially in women's empowerment, that just were so tough that I couldn't handle it. I either would play video games, or when my partner would come home, I would tell him everything I learned, and he'd be like, "Oh God, how do I process this?" Because there's some tough topics out there. But after, whatever session I had of self-care, it would just be like studying for the rest of the night. Using Peggy's techniques, there were, a couple hours that you dedicate for that class to review what you learned that day, or to review if there's a test next week. But definitely see Peggy. She'll help you out with what to do after class, because there's some really cool stuff that she was teaching me. And then after that, maybe dinner, and then more study, and then sleep. But lots of study. On the weekends, sometimes I wanted to be a human and go grocery shopping, but the studying stuff came first.
I would say in between, so obviously it's 8 to 5, essentially you're at school. But there are breaks in between. And so what that looks like, at least what it looked like for me, is an opportunity to make friends and make connections and see what people are interested in. So those are always fun, I could find myself either hanging out with my friends or taking a nap in the hallway, honestly, because I was so exhausted from everything. Like Linnea said, yes, afterwards, I think self-care is extremely important. I know that a lot of our cohort mates like to go out a lot, and so people would go and explore the city. I, again, was an older student. I had lived in the city for years. I was like, no, but sometimes I'd go out and I could participate and do things like that. One thing that I wasn't used to, I would say, in terms of class and class schedule, that I would highlight, especially those of you who are not transitioning, because in my cohort, we had a lot of people transitioning directly from undergrad to this program, but people who are looking at this as a part of their career trajectory, is that, at work, but also in my undergrad, we got to pick and choose the times and classes that we wanted to attend. And I think that's extremely different from this program. I remember one of the things that I definitely, part of the learning curve, is that you have to show up on time, and that on timeliness is a part of your actual grade. And for me, again, because I had been working for so long, because I had been in these positions, and even in undergrad, I was able to pick and choose, okay, if I stayed up till 1 a.m. working on this project yesterday, then I'll just sort of come in 10 minutes late. It's okay, because, I was able to set my own schedule and be okay with it, but that's not exactly how the program works. And so I just want to say, I just want to be really clear about that, because I think that for me was a learning, because I'd been so not used to that. And that does reflect on your grades.
I really appreciate you bringing that up, Serchel, too. So I just want people to be brutally honest, because it is, you want to go in eyes wide open. It is so much work. Having gone to medical school myself, having done other residency, other training programs, masters myself, you know, it seems like, okay, it's school, right? You can do it. You've done school for a certain number of years, but it is a different kind of commitment. And what Serchel brings up about being present, it sounds a little odd, right? You're adult learners. Like, why are we requiring people to be there? But it's incredibly important to the pedagogy. The pedagogy, what you learn and what you teach, what we teach and what we learn is based on all the people who are in the room. So it is really important to recognize that even though we value our faculty who have lots of experience, and our guest speakers and our staff, all of whom have tons of experience, being present as a member of the cohort is absolutely essential, because everyone in the cohorts also not only learning from the faculty, but learning from each other. And that's really important to us. It's not just because, it's partly the style of learning or style of teaching, but because we recognize two really important things in global health. One of those important things is that we clearly do not have the solutions. And if we had the solutions, it would be a very different field and the world would look very different. And we can't create solutions just from what we know. We have to be able to ask questions and challenge the things that we know. And our learners are really important to that. When someone comes up and asks, wait, why do you do that way? We have an opportunity that we didn't have before to relearn or rethink. And then the other reason that our cohort's very important is that we try very, very hard, recognizing, of course, with humility, that the financial limitations can be difficult, to make sure our cohort is diverse in its own lived experiences and diverse in their approaches, what they've learned, what they've studied, where they come from, where they plan to work. And that is extra important in global health, because again, the work we do is a lot about the communities we're working alongside, we're working with, the communities we come from, the communities we plan to be in later. And so in order to have our learners, by having our learners come from lots of different settings, we're enhancing our opportunities to have impact. And so that's why every voice and being in the classroom is really important. And it's really different than kind of trying to absorb information. It's absorbing information, but at the very same time, creating new information and creating new ideas together. So we're really very sort of strict about not just attendance, but like really participation and being present. And that's how a lot of the learning happens. So thanks for bringing that up too. That allows me to, feel free to put more questions in the chat, but it does allow me to bring up this other question, which we had already, which is, what was your own experience with your cohort faculty and other mentors? Like, to tell us a little bit about the role that those folks played in the program for you.
I'll go. Yeah, I think my cohort was my heart, rock, and soul of this experience. Honestly, the mentors, of course, were there for you throughout the project and always available and able to help, but and the faculty as well. You learned so much, and they were always eager to answer questions, like even after a test, when you would get little things wrong that you were like, why did I get this wrong? I remember studying this. Like, you would go up to them and they'd like just tell you and just really go into depth, and like they can understand what you were thinking and how they answered the question, and they took that feedback. And I thought that was, something that I had an experience in undergrad, right? Like, I would ask an undergrad chemistry teacher, like, this question doesn't make sense. They'd be like, so you got it wrong. But my cohort was what got me through the year. Like Madhavi said, you learn so much from each other, and you see each other every day for so many hours a day that it becomes like, I don't know, like you are like your roommates with everyone, I guess, is a good way to put it. And you get to learn like where everyone else is in the process and how other people have like tackled an assignment or their capstone and things that they've done. resources that they found. And I think that was very helpful. And after school and during those breaks that we got during class, having those people to talk to, decompress with, complain, that was also very useful throughout the program.
Yeah, and I can add on how important the cohort was. Like, I remember there was a week or something before the final, we were kind of so overwhelmed by everything. We just brought in our Wii station, our Wii Switch and all that, and just took one of the conference rooms in mission halls and played games there just to decompress. Because usually we would just fill up the board with all our notes, but it is super important, like having that group there. I was fortunate to live on campus, but the other people in my specific study group, like, you know, some lived off campus and drove in to do those study sessions. And faculty were they had such great stories with their own experiences. And I think the stories helped me learn more about a specific topic. And then for my mentor, specifically my capstone one, he was super crucial in my learning, and I got to complain to him a lot about what was going on and what I was struggling with. So A+.
What was my experience? I would say, starting with the student cohort, we were definitely a diverse group. You know, it's something that I wanted and something that I just expected, but what I liked about it, I would say, is that it wasn't diverse and just like diversity is great and everyone is awesome. It was like we had some really distinct and specific perspectives about our beliefs and our view, our lens of the world. And I think that was good in that for me, I was like, nice, like, I'm like, that is so not at all the liberal perspective, but this person is voicing it and that actually has health implications, but still, this is really interesting to explore. So that was great. I would say that the cohort, I love my cohort mates. We spent a lot of time, especially those that I got really close to. And unlike Akasha's experience, I wasn't quite roommates with them because, you know, I was here, I had my own roots, right? Like I had my own friends. But for those that I did really like bond and close with, like I would just like take them to where my workplace was and we would study like late nights, you know, with the sessions together. That was always a good experience. I think the cohort itself, again, being an older student, was really young. Everyone was basically out of undergrad and everyone wanted to go to medical school afterwards. And so it was definitely, for me, felt like a lot of mentoring and sort of answering questions to the cohort. So all of that, it was just a very unique experience and I really liked it. And I think that also played to how people responded to sort of the disparate opinions about different topics. And I would say in terms of faculty and mentors, one thing that I did learn, I would say, is that, you know, like in other programs, especially in my undergrad, I went to San Jose State, and at work and things, like I had always been able to really be extremely like direct and honest. And I would say that in this program, that can be true, but I would say that what I would focus on more and what I learned is, you know, there's like, it's professional, like these people are going to be your professional colleagues in the future. And so with your mentor, as you know, as some of you said, like, yeah, completely honest, you can be super raw, but with other people in the program, it's really important to remember who they are, what their position is, and you know, what and how you say things to them in a professional manner, because they will be your network moving forward. And I know it was an interesting learning for me because previous to the program, my communication style was landed across the board, but it was different once I arrived at the program. And I thought that was great. I definitely did learn a lot.
Thanks for sharing that. I think that thinking about individual and professional growth is definitely a key element of the program as we go along. There are a couple more questions that I'm going to, I know Linnea is partly answering the one from Jasmine, but one of the attendees asked Akasha, but all of, you know, how do students sometimes interview for medical school during the year? And I think I'm going to go ahead and answer that since you did that afterwards. But there was also the question that about whether or not people also attend law school. So let me just say, first of all, even though this panel has a lot of people who are thinking about medicine, we do have many, many students who are either health professionals or think about health professions education afterwards. So we've had students go into medical school, nursing school, pharmacy school, dentistry school, PA school, and then within medical school, MD and DO schools, as well as folks who've thought about, and of course, nursing. And then we've had a lot of others, though, who go on to do work that is in other professions as well. So PhDs and then law school. Yes, we've had, I can think of at least 2 students who've gone on to law school, and one that came in before, actually one of our students who, I'm really excited, he finished law school and he's working in the East Bay now. He was in Washington, D.C. for law school. So we've had a lot of students who do that. Now, applying during the year is okay, but it is hard. And if you've done your exams prior to starting the year, so MCATs, LSATs, et cetera, that is preferential, because studying for those exams while in school and applying at the same time is quite difficult. You can go for interviews. You do miss classes. And when you miss classes, when a class is really quick and you only have 10 classes and you miss 2 out of the 10 for interviews, you're missing 20% of the class, and catching up is sometimes hard, but certainly there are opportunities to do that. So we do, if that's your path and process, we certainly would encourage you to do that. But many, many, many of our students wait an extra year or so afterwards if they to consider applying, because it can take quite some time as you go along too.
Can I add just 2 cents to that, Madhavi, because I think you hit perfectly. So yeah, I did not have any intentions of applying that year. Like I said, I was kind of deciding on if this medical school was even something I wanted to do. I started the program when I was 21. I'm now 26, just going into medical school. Okay, so it doesn't happen overnight. But yes, I did have, I knew 2 people in my program who were interviewing actively during our program, and it was challenging. I remember somebody, like, there was a deadline that was just hard and fast in the program, and that's not the program's fault, like we signed up for it. This is a deadline. It was close to our capstone end, and she was really struggling trying to manage like how she was going to get into the interview and then come back and do that. That's just something you're going to have to weigh yourself if you're willing to do. And like Madhavi said, I know 2 people, I think one person who went to law school, and we actually had an engineering major in our program as well. And she was honestly blew my mind every time she spoke, because I don't think like that. And I'm pretty sure she's not in any type of health field right now. She's continuing her engineering path. So it's definitely not just for people who want to do medicine, I would say.
Yes, absolutely. And we do, that's really, really important. In global health in general, we have a slight bias in our program, not because we don't believe in all of those things, but because UCSF is a health sciences institution. So many of our mentors on projects have a health sciences bend, but we absolutely value the other aspects. And Linnea reminded us of an elective that we used to do with UC Hastings. There are other similar electives that are going on. And then Jasmine, who also asked that question, asked whether or not about travel and travel restrictions. So I'll answer that. We did have travel. So our cohort that graduated in 2021 was entirely remote and could not do capstone projects remote, travel for their capstone projects. This cohort, I think 7 of our students will be, or actually 8 have requested, but probably 7 will be traveling. But there are still some potential restrictions based on both university requirements, but also very specifically to, as you all know, the pandemic has led to very significant disparities, and both issues of access to resources when traveling, and when we're thinking about traveling, we're of course thinking about the student, but we're also thinking about the student's risk of health from a health and safety standpoint, but we're also thinking about the burden on the healthcare system in the settings that we're going to. So is there a system in place for people if they get sick? If there are resources, what is the impact on our partner sites if somebody gets sick? And so we've had to take that into account. I do suspect for the following year, the one that's upcoming, the one that you would join, that those restrictions will be even more lifted. But certainly those restrictions are not really placed by us. They're placed by, should there be another surge, everything changes. But access to vaccination, access to health systems, access to resources, that all makes a difference too. But hopefully everything will be as open as possible by next year. And it's already so much the case this year as well. Okay, so instead of, feel free to continue to ask questions. We just have a few minutes left. So maybe instead of asking any additional questions formally that were on my list, I'll just ask each of you to share if there's anything that you wish you had known before you started the program, or you want people to know while they're thinking about whether they want to join the program or apply, or any last words you want to share.
I feel like we've covered so many things. My brain's like, yeah, we did great.
You did great, for sure.
Yeah, I'm not sure. I just wanted to say that. But if anyone else has any questions, feel free to pop in. I'll keep thinking of what I learned.
I can, it is a hard question. I mean, not that we didn't learn anything, but like, it's just so much. I would say that if there is one thing I would do differently, I'm trying to think, because I learned so much, just like personally, professionally, and as a student. But so if there's one thing I would change is my expectation of what I would get out of the post program. So this was absolutely clear, and I'm sure you guys are super clear, and it's never changed since, this program. But, this program isn't directed for you to get a job afterwards. Like, that's not like, it doesn't necessarily funnel for that. And so I don't know that I expected that, but because of, I would say I would sort of shift my perspective more towards like, how much can I get out of this program in terms of like tools and experiences and things that I can put on my resume to help that build my future career. And it has, and it did. And I really, honestly, like, I can't really think of anything I would change, but I would say maybe just my perspective in being a little bit more open. And then final words, I would say that, this program was an amazing experience. I love my capstone. I could talk about it for like ever. I would say, if you're really thinking about this, if you're passionate about global health, if you're really exploring your career, it really is a year. This is my experience. Like, it was a year of exploration, of growth and development, and something that was super useful and important for me in informing, the direction in which I'm taking my career. And I think that is, that's like priceless for me, because I think I was like exploring so many options and sort of thinking about where to go. And for me, that was just absolutely amazing. And I met so many great people and continue to be connected. And as, it was 2017. So as the years go on, I continue to like uncover the things that this program has offered me. I'm just like, oh, I learned that here. And oh, like I can, it's just really amazing. And how, the legacy of my experience in the program has continued to live on. So if you're on the fence or you're thinking about it, I would say, this definitely can be an informative and great experience for you.
Because there are a couple of questions flying in, I might ask you, Akasha, if you are open to answering the one that said, how do you think you'll incorporate what you learned in your chosen path going forward?
Yeah, I was actually going to ask you if I could answer that one. So I think I echo everything that Social just said. Like, the amount of skills and tactics that you learn in this program, again, it's not just like in the classroom doing your assignments, doing your homework, doing your capstone. Like, you are so challenged with everything that you do in this. It really takes people out of their comfort zone. You really have to be open-minded. I think that's one thing I really learned, was just like, my way of thinking isn't the only way of thinking, and that's okay. And as long as we can analyze that and process it, that's fine. Going forward in the future, kind of the same thing as Social. Like, I was like, okay, I'm going to get my master's. I'm going to get a job right away. That didn't happen for me. Like, I had a couple of jobs along the way. I went to Panama and I did like a educational auditor thing for 6 months. Then I went back home and I worked at a pathology lab for 6 months. So it really does take its own journey, so to speak. But every job that I've had up until now has gotten me where I am today. And I think this program was honestly the main reason it happened. As for what I do today and how it implements my job, like I said, I currently work in research. So one big thing that I do every day is I read a ton of protocols. We have people applying to get funding for GE. We are technically like a sponsor for these ultrasound devices that are pre-market or not available commercially. So I'm reading a ton of protocols. It was very helpful in my capstone to know like how to write one, what's included in every section of one, what's important, what's missing, because I essentially assess who gets funding and what projects we support. Same thing for a research coordinator. You have to be like completely involved in the protocol and know everything in and out so that you can do the research correctly, right? IRB application, so that was something that you learned and I use every single day. I probably submit an IRB application once a week. So there was a lot of like skills that I learned that I use in my job currently.
Thank you so much for that. We are just kind of right at the end of our time. So I just wanted to take first a moment to let all of our attendees know that if you have ongoing questions, you can at any time email the Education at Global Health email address, which I'm sure Rachel will add. And thank you, Rachel, for adding information so far on financial aid, where this recording will be, and also the email address to reach out to us anytime. If you have questions that might be specific that some alums, both the ones that are here or other alums can answer, we can certainly look into connecting you. But on top of that information, I just wanted to really say thank you to the three of you. I know that we talked about the importance of the cohort for each of you, but I have to say that I am really, really lucky to spend the entire year connecting with our students, both because we get to be in class together 9 months of the year, every single week for 3 hours, but also because I have the pleasure of really staying in touch with almost all of our alums, or many, many of our alums over the years. And so it's not just only a pleasure for me to see what's happening afterwards, but just I have immense gratitude for the ways that you all commit when you're in the program and afterwards to supporting the program and future students. So thank you so much for being here. Thank you both.
Thanks, everyone.
Yeah, and thanks to Rachel and Robert for all the background work.
Thank you.
Okay, bye everyone.
Bye.